Well, it's an interesting one. We first sort of dealt with the challenge of talking to patients with filgrastim. Okay, you've been getting this one branded filgrastim, but now, our institution is switching to this other one, which is a biosimilar. It's been tested in the laboratory and in the clinic. It looks to be the same. Patients did not care. I mean, not even blink an eye. And meanwhile, they don't like the generic, ibuprofen and say the pink one isn't as good as the white one, or that gave me a headache or a rash or whatever it is. So I think that there is more attention paid to that than there is to this switch. Growth factors may be different than when we start looking at therapeutic drugs, particularly in the curable setting like trastuzumab. So, will patients, feel differently and feel anxious about, switching? We don't really know. So the question is, in an area where the insurance is paying for the drug, will we transition patients who are already on the reference biologic? Probably not, because what's the push? Unless you're going for your 6-month approval and now the insurer says, I'm only going to pay for this, and then we're going to transition them. But for naive patients, I think that when we're starting drug, if we have that drug and it's less expensive and we look at the data and the FDA has looked at the data and feel that it meets the criteria for a biosimilar, I think it would be fine to use the biosimilar instead. For patient education, it's interesting. I was thinking that, I show Google images to patients all the time to show them, for example, that transdermal delivery system for pegfilgrastim. I show them what a port looks like. I show them what, some unusual finding that is mentioned in their radiology report. I can often show it on Google Images better than I can show it in their own X-ray images. And I think it helps a lot with patient education. So I do think that educational tools for patients will be very helpful in understanding what biosimilars are, showing the small molecule and the big antibody, the difference between the generic and the biosimilar, and also those triangles about how you really assess them and the kind of robust evaluation that has gone on, and then also just the regulatory guidance that has been given that people have agreed on internationally. I think that those are all very comforting for patients. And the fact that they don't cause antibodies and, if anything, are very, very well studied in terms of safety.
Manufacturers provide patients with informational material in printed form as well as in form of webcasts and other e-learning devices and informational material. In addition to that, they do a lot of effort, for example, at clinical conferences such as the annual meetings of ASCO or the European Society of Medical Oncology, to educate physicians and, in addition, patients to give them more information about the use of biosimilars.
I think that the biosimilar companies are going to be doing work on patient education and physician education, provider education. I think both of these areas are really important. In terms of the patients, it's just understanding the basics behind biosimilars. And I've seen some of these sort of start up, looking at how we're going to tell patients what these are and, how much role are patients having in making that decision. We let them know. Do they get to decide yes or no? Would they, if they can't, if the insurer says I'm only paying 80% of the reference biologic but all of the biosimilar, how will we sort of make those decisions? And that remains to be seen. I'm not even sure the insurers know yet. So I know that the insurers have already gone to, wanting to support the biosimilar filgrastim versus the branded product in many cases. So.